Class, let's go over the male reproductive system. We can start off by seeing the penis in front and the scrotal sac behind. And if we look at the front of the penis, we can remove this area of skin here called the prepuce or the foreskin. If we get rid of the skin altogether, we could see that we have inside the scrotal sac the testicles, and we have this fascia around it called the dartus fascia. The dartus fascia has this dartus smooth muscle that allows the contraction, relaxation of the scrotal sac, which actually will cause the testicles to raise and lower so that we have better sperm production. Sperm actually are produced and stored at lower than body temperature, or cooler than body temperature. So if we remove that prepuce, or that dartus muscle, we can again see not only do we have the testicles here, but we have the spermatic fascia or the spermatic cord. The spermatic cord is going to go up and enter the male pelvis, and the spermatic cord is going to contain the vas deferens or the ductus deferens, which is right here, and it's also going to contain the testicular artery, the testicular vein, and the testicular nerve. So with that, let's go ahead and look at the prostate. If we look at the prostate here, we could see there's the outer layer. If we go inside, we can not only see the prostatic urethra that we talked about in the urinary chapter, but we can also see over here, trying to get to it, the ejaculatory duct. And the ejaculatory duct is where the vas deferens is going to come into play along with the seminal vesicles, and the seminal vesicles and the vas deferens is going to dump their contents into the prostate. So going back to the testicles are going to produce the sperm, and they're going to be stored in an area here called the epididymis. So sperm are produced in the testicles, they're stored in the epididymis, and then when they leave, they go through the spermatic cord within the vas deferens, and they join up with the seminal vesicles, and the seminal vesicles actually produce 70% of the fluid of semen. They also contain a type of fructose or sugar that are embedded on the bodies and tails of the sperm to allow them energy for their up to 3-day travel within the female. The prostate itself is going to produce a milky-like alkaline fluid, and this milky-like alkaline fluid is going to activate the sperm heads because the inside of the female flora is slightly acidic. So we're going to have this alkaline coating on the heads so that they have better protection. Now, prior to all this coming together, where everything reaches the prostate, we have these little tiny vesicles here called the bulbourethral glands or Cowper's gland, which are going to give rise to a clear type of fluid that is going to go into the urethra, the penile urethra or the spongy urethra of the male, and it's going to allow to lubricate and get any urine out of the penile urethra prior to ejaculate. So if we look at the penis itself, we actually have two types of erectile tissues. We have corpus spongiosum and corpus cavernosum. Corpus spongiosum is going to be around the urethra itself, and corpus cavernosum is going to be the main erectile tissue of the penis. Going down to the head of the penis, it's also called the glands of the penis, and it is interesting to note that the male vas deferens is going to arch around the ureter. So here's the ureter, which is going to the bladder, and again, the vas deferens is going to wrap around it, going behind the bladder, and go into the ejaculatory duct along with the seminal vesicles. If a male gets a vasectomy, what they simply do is they simply cut a portion of the vas deferens here so that when semen comes out of the male penis, it contains all the fluid of semen except for the sperm that were produced in the testicles and stored in the epididymis. And that is it.